Hi, everyone. Welcome. Thank you so much for joining us. All right. So we are excited to talk about hormones today. Um, I am going to introduce myself, Jen Collins. I'm a nurse practitioner and owner of Your Beautiful Aesthetics. And my background is when I started off as a nurse many years ago, I worked as a nurse in cardiac and really kind of all things in the hospital. Kind of a jack of all trades as a nurse for about 11 years. And then I went to NP school and I had the opportunity of doing my clinical hours as a student at DeRosa Medical, which we did hormones and also primary care. So that's how where I owe my knowledge and where it really got me started off in my career. So I'm very grateful there. And then since I've been on my own, fully on my own now for 5 years, and we've brought on Christina within the last year, and I'll let her tell you a little about herself.
Hi, everyone. My name is Christina Johansson. As Jen mentioned, I'm a nurse practitioner. I was a bedside nurse at Mayo Clinic Hospital for about 6.5 years. I kind of worked in solid organ transplant, so kidney, liver, pancreas, and then we saw a lot of acute conditions as well. So, similar to Jen, jack of all trades, been there, done that. And then I have been a nurse practitioner now for about 8 years. When I first joined being a nurse practitioner, I actually was really lucky to be able to work at the same clinic at DeRosa that Jen did. So that's too where I gained all of my hormone knowledge, training under Dr. Angela DeRosa, who we talk about all the time. She is a hormone guru expert. And then I moved to Colorado and did primary care, urgent care, walk-in clinics. I've done all of it, and then have been so grateful to join Jen in her practice at Your Beautiful Aesthetics.
Great. And then I just want to mention that we love what we do here at Your Beautiful Aesthetics just because we can really help make people feel better. And so feel better when they literally don't feel well. And also tie in the aesthetics part to where they feel better about themselves as well. So the confidence aspect. And it's just been really neat. It's very rewarding. And we're happy to have you all as patients and we'll go ahead and get started here.
Awesome.
All right. So menopause is a naturally occurring process, and it's diagnosed after going a full year without having a menstrual cycle. It happens around the age of 45 to 55, but symptoms start around age 40 and and that can vary. I mean, sometimes people start feeling symptoms younger in their 30s. And sometimes those symptoms can last well into I mean, sometimes it's short-lived, but sometimes they can last into the 70s, 80s. So it's different for everyone, and that's why it's very important to be customized. It's never a one size fits all. And then there are some women who unfortunately experience early menopause even in their 30s. And this can kind of go undetected, especially if they're not seeing the right specialists. Symptoms may occur in up to 80% of menopausal women also. So that's a really large number.
Think I saw somewhere that we spend a third of our lives in menopause,
Jeez.
which is like a horrible time frame to be having a poor quality of life without treatment.
Absolutely. And that's usually when like you have you're busy, you have
Yeah,
kids to take
living life.
care of.
Yeah.
So symptoms in menopause. So there is, the classic hot flashes, night sweats. Those can be very debilitating for people. I mean, really that those can just be miserable in Arizona too. Dry skin, also, that's being in Arizona, we already have that going for us. Poor concentration and brain fog, forgetfulness. This can be very hard, especially, when you got like a job where you got to be like spot on. It's very frustrating. Mood and irritability, depression. We have the vaginal dryness and painful intercourse, heart palpitations. We do find that sometimes, they do these really extensive cardiac workups on people and they don't find anything, and it really can just be to estrogen deficiency. Not to say that you wouldn't want to rule out cardiac, but we do see that. Trouble sleeping and insomnia, increased allergies, and also fatigue is a really big one. Low libido, weight gain, increased belly fat and midsection fat, loss of focus, lack of motivation, low activity tolerance, decreased muscle mass, muscle pain, sugar cravings, headaches, migraines, anxiety, depression, all the fun things.
You
I mean,
know,
geez, so
and
depressing.
I feel like as women, we get used to feeling that way.
Right. You
And we're
can
like, we just,
set
this is
your
how it's
bar,
supposed to be.
right? Or you just contribute it to,
Right.
well, I have a busy job or I have a busy life, and you don't even realize how you can
And you
feel.
get acclimated to it. And you're like,
Mhm.
this is my new normal. And it doesn't have to be that way. So
Absolutely.
when we talk about decreased testosterone production, there are a lot of contributing factors like sex hormone binding globulin. This binds up all of our testosterone and it really prevents our testosterone from being active. There are some reasons that we have an increased sex hormone binding globulin, and that could be through oral birth controls. Certainly, advanced age, certain antidepressants can actually increase the sex hormone binding globulin, certain cardiac meds, and pain medications. Some other reasons that can contribute to a lower testosterone would be drug and alcohol abuse, premature ovarian failure, steroid use, and then certainly some other internal issues with a low pituitary, some adrenal insufficiency, and certainly if you've gone through any cancer therapy with chemo and radiation.
Oh, sorry.
Oops.
See that. All right. So, this is you.
Yeah, so skin health. So, we talked about a lot of the symptoms and the side effects. There's a lot of really great therapeutic benefit to getting hormone balance, and one of the benefits is skin health. So, estrogen therapy increases our collagen production and it helps maintain our collagen. In addition, it can actually help increase our dermal hyaluronic acid, and hyaluronic acid is super important to hydrate and plump the skin. It's a naturally occurring sugar in our bodies. And so it's a key component of what some of the dermal fillers are that we use that's made up of. And having estrogen therapy increases that natural hyaluronic acid. In addition, the estrogen therapy can help improve the thickness of skin, which, yes, please, thank you. It'll improve the appearance of fine lines and wrinkles. It actually can be very protective to the skin, so it can help reduce oxidative damage, which is like environmental pollution and smoking. It can also help improve the elasticity of our skin, so that skin snapback, and then certainly can help increase the blood flow, which helps to promote healing.
Right. Okay, so bone health. Sorry, I'm having technical difficulties over here. So bone health. So it's very important for with as we age that we protect our bones. Um, and replacing hormones as we age, we have a decline in all the hormones. Estrogen and progesterone actually promote osteoblasts, the cells that create new bone, and testosterone plays a role in calcium metabolism and bone mineralization. So we do DEXA scans on our patients to see where they're at, and it's very interesting. I have a patient who has been coming to me now, starting off at Jerosa and over at my practice now, for probably about 8 years, and she came to me initially because she wanted to improve her bones. She had osteoporosis. Her doctor wanted to put her on the bisphosphonates medications, which had a lot of risks and side effects. And so once we have replaced her hormones and she's doing all the things that she's supposed to do with the weight bearing, calcium and vitamin D, a healthy diet, but she continues to improve with her bone density every 2 years, and she's now into just a slight osteopenia range. So it's amazing. I wish we had done a study on her. She is it's amazing to see that. Sexual health. So we can improve a lot of symptoms that our patients come in for. Sexual intimacy and being close to your partner is very important. It can cause a lot of issues in a relationship when there's a mismatch. And for women, if we have vaginal dryness and atrophy of our vaginal tissues, lack of moisture, the intercourse can be painful. So then it's not pleasurable. So it's like, why would you want to? But also, helping lubrication. Testosterone and estrogen both really help with libido. So just that desire, sometimes that is lacking, and so that can cause increase or decrease intimacy. And so we really get a lot of some patients that just come because of that, and that's their main thing. And then they get all the other benefits of the hormones as well. Not to mention, sometimes we also one of, sometimes it can not be due to just that, but it can be due to maybe some issues in the relationship. I had a patient once who brought her husband in, and they like kind of use it as a counseling session as well. And I'm talking to them and I'm realizing that they don't even like each other. I'm like, you guys, like, I don't know if I can help you here, so I,
The hormones.
yeah, in the world. Yeah. So I think, there's obviously other things that can contribute to issues there, but also we do get a lot of women who, they get feeling really well and they get their libido back, and their partner is there's a mismatch. And so a lot of the times it's a good opportunity to like get that husband in and get them treated as well. And then there's some other things that we use, like some peptides and oxytocin, which can help, but we do see a lot of improvement with this, and it's very important.
Well, and I think people don't realize too is they associate testosterone being a male dominant hormone,
Hmm.
but
Hmm.
when we break down our hormones, we're 60% estrogen and 40%
Hmm.
testosterone,
Hmm.
which is a lot more testosterone than people realize. So it really is important.
Yes.
So, speaking about hormone imbalances with estrogen, cortisol, testosterone, all of those, when they're imbalanced, can make it just really hard to lose weight. And we know that estrogen's needed in order to have proper mitochondrial function. And that process, in turn, helps to burn fat in our cells. So, when we can get those all regulated, we have improvement in body weight, improvement in fat distribution. So, testosterone therapy in particular can actually pull sugar into the muscles as opposed to the fat. So, you get more muscle definition, you have improvement in your weight workout tolerance. It can help regulate appetite, even. Estrogen helps reduce the potency of CCK, which is a hormone that helps you feel full and satisfied. And both the testosterone and estrogen can help reduce the amount of leptin and ghrelin in our body, which is what makes us feel less hungry. And then metabolic rate, testosterone actually increases that, which is the number of calories that your body needs in order to burn off fat. And then certainly, lifestyle factors with diet, exercise, regulating sleep, and stress management can all help with weight loss. And certainly, we offer weight loss programs here at Your Beautiful Aesthetics. So we do prescribe compounded semaglutide and tirzepatide, which is kind of the big hype right now with the GLPs out there. So if that's something that you're interested in, certainly regulating your hormones, if you're still having issues with getting your weight where you want it, that is certainly something that we can add to and augment your overall therapy.
Yes.
So sleep quality, 63% of menopausal women have problems with their sleep, which is a huge component of our overall health and well-being. When we sleep, sleep is restorative. That's where things are recharging, regenerating. And having improved sleep quality just gives us that overall well-being, improvement in our cognition, our memory, improvement in our energy, decreased fatigue, improved mood, like all of the health benefits that we need. By decreasing hot flashes and night sweats, that'll help improve our sleep. Like Jen mentioned in the beginning, hot flashes and night sweats can be debilitating. I'm throwing my sheets off, I'm taking them off, I'm on the fan, I'm in the fan. So it's certainly something that hinders when it's out of whack. And then estrogen treatment is very effective for improving sleep in females, especially when they're coupled with having those night sweats.
So we get a lot of patients that get headaches and migraines, and certainly there can be a lot of causes for these symptoms. But sometimes we find that it's actually related to a decrease in our hormones. And we can see that sometimes when we're looking at like a menstruating female and where they actually are, when they're actually experiencing the migraine, and then figure out like, okay, well, that stage of your cycle is when you have a plummet of estrogen. And so it's related to estrogen deficiency. And so it's kind of cool that we can like kind of figure that out. But then if you think about someone who isn't actually in menopause, they don't have those hormones at all. So if it's so replacing those can help their symptoms. So we it's always certainly a plus for those patients that have those, if those help with that. So so there seems to be a huge disconnect for patients. I mean, they go to their doctor, they're a good patient, go to their primary, and it can be very frustrating because a lot of the times, they'll do the basic labs and they'll tell them like nothing's wrong, you're good. And they're really the provider is really feels maybe at a loss of helping them because they don't see anything in their normal lab levels to help them. And then women, they might check their hormones, or maybe the patient asks for them to check their hormones, and then they're in these reference ranges, but it doesn't mean that that's what where the patient feels well, or and it's just very frustrating for patients. And but the symptoms of menopause, they can be really improved, and we can really improve quality of life.
So our approach at Your Beautiful Aesthetics is we, certainly take an individualized approach. We listen to your needs and we want to make you feel comfortable. These are tricky topics to kind of navigate through. So we want to make sure that you are comfortable talking to us about it. We have a consult with you where we talk about realistic expectations and then certainly skillful medical expertise in order to create a customized plan of care that's just tailored for you. So we're going to take a look at the full picture of you. And what that means is we're going to look at your personal history. We're going to look at your family history. We're going to do a physical exam. We're going to look at your symptoms. And then we'll certainly do a workup that'll include some blood work. We can also do saliva and urinary testing if we need to. And ultimately, we want to rule out other causes. When we talked about the symptoms of estrogen deficiency and testosterone deficiency, a lot of those kind of co-mingle, and it could be they're kind of sometimes non-specific, and it could be
Mhm.
that there's other things going on, like a thyroid dysfunction that's going on. Maybe there's underlying diabetes that we're not sure of, or there's a vitamin deficiency that we need to be aware of to correct. So we're going to do a bunch of labs to kind of look at the full picture. We certainly will look at associated risks as well. And we want to make sure that you're up to date on your mammogram, your pap smear, and your bone density as well. There are some non-hormonal replacement options that we just kind of wanted to briefly touch on. Certainly, there are different antidepressants that are SSRIs that actually can help reduce some of the symptoms and side effects of of menopause. But that's a tricky one because it can increase the sex hormone binding globulin, which would then kind of gobble up your testosterone. So tricky. There are certainly supplements listed here on the slide. DIM is another supplement that can help reduce symptoms of estrogen excess, and then DHEA is a supplement that we do typically check a DHEA level to help kind of support your adrenals to make sure your stress hormones are good there, and that can also help support your immune system.
So I just wanted to talk a little bit about oral estrogen therapy. And the use of this seems to become is becoming less and
Plus,
less as providers are more aware. But it's still out there, and I still get patients coming in on oral estrogen. And it's covered by your insurance usually, it goes to the pharmacy, but an oral estrogen, when you take it, it converts to estrone, and it goes through our liver metabolism. So it is activating your clotting factors. So it can put people at risk for blood clots, stroke. And so and it also can increase inflammatory markers, triglyceride levels. And so we really avoid oral estrogens, but not to, there is oral birth control, and I'm not going to get into that by any means, because we do believe in oral birth control, and it works and it's good, and there's a time and a place for it, and kind of more talking more about just like Premarin and like the oral estrogen used for estrogen deficiency. So we always have to look at the benefit versus risk, and certainly there can be a risk with oral birth control as well, but there's a time and a place for it. So a lot of people will commonly ask, like, is this covered by my insurance? And is it FDA regulated? So the FDA, the Food and Drug Administration, is a very stringent administration that regulates all things medical for us, which is amazing. But they're not going to regulate the compounded medications, because they can't, like, they're custom made for each patient, so they can't possibly like test all of those. So that's why, like, all the compound pharmacies, the medication you get from those are not regulated. A medication that goes to like CVS and your pharmacy, like, those are they're the same, they're not customized per patient. So
cookie cutter.
yeah, cookie cutter. So because the FDA does not regulate them, or they're not approved, insurance companies don't really have to cover them. So that's kind of the disconnect right there. But compound pharmacies have real pharmacists. They're brilliant. Like we work with some amazing pharmacies and they're very smart and intuitive and so they're highly trained and the FDA highly regulates these pharmacies. And almost sometimes making it hard for them to do anything. But I just wanted to clear that up because I think there's kind of a disconnect there a little bit too, and I just wanted to speak to how highly we feel these compound pharmacies are amazing and we trust them. They make really good medications that help people. Yes, absolutely.
Yeah. All right, so some delivery method options, we do bioidentical hormone replacement therapy. So what that means is it's coming from a plant base. It closely resembles your body's own production of hormones. And we use them with testosterone, estrogen, progesterone. So one of the options that we do are pellets. So those are compounded soy or yams, and those are compressed together into a small pellet. Typically, a grain of rice. We'll show it on the next slide so you'll get a better idea. But ultimately, it's an in-office procedure where they are inserted into the subcutaneous fat for absorption into the bloodstream. I'm going to go a little bit more in detail and about pellets on the next slide, but some other delivery method options, we certainly have the way to compound topical creams that you can apply daily. There's troches or sublingual under the tongue dissolvable tablets. The nice thing about those is, we talk about putting it in your mouth and we were talking about oral estrogen, but this is immediately released kind of into the bloodstream. So we bypass going through the stomach, going to the liver, and we are not activating any of the liver clotting cascade effect. So that's the benefit with the troches and the sublinguals. And then certainly there are estrogen patches, which you have to place onto the skin twice weekly or once weekly. And then there are vaginal creams and suppository that is low dose for kind of more immediate topical treatment. And all of it can really help with vaginal burning and frequent urinary tract infections, but it's more of a localized treatment there. So pellets, you can kind of see a picture here. The larger one is testosterone, and then some of the other ones are smaller testosterone pellets or estrogen, but that's typically what they look like. And so pellets are really wonderful. We can really customize your dose based on your symptoms, based on blood work. And the nice thing about it is it's a consistent and controlled release of hormones based on what our body needs. I kind of like Dr. DeRosa used to describe it as a lollipop for your body. So your body kind of takes licks off of it and uses it up how it needs to.
I like it.
Yeah, pop going on right now, but it's really neat because it allows for this consistent and controlled release of hormones, and those typically burn off over a 3 to 4 month period. A lot of women will come in and say, "Man, in the last week or two, I've really been noticing my hormones kind of burning off, and I started to have kind of a surge of symptoms." Our goal, though, is for your levels to get up where they need to be and sustain them over that period of time, so that when you come in, you're feeling great still, and we just have to keep the momentum going with dosing you appropriately. And the nice thing about pellets is that once they're inserted, you don't have to take anything every day, unless you're on progesterone and then you have to take your hormone, but at nighttime, but that's a different story. And then post pellet care, certainly, like I mentioned, it is an in-office procedure where we are making an incision and inserting them into the subcutaneous tissue. So there are some post pellet care instructions with, your site might be sore for up to a week. We want to make sure that for the 3 days following that you're not doing anything strenuous with lower body workouts. You don't soak in a bath or pool or a spa. Mainly, we want to make sure that integrity of the skin where we made the incision heals appropriately and that we have a low risk of pellets extruding or there be a lower risk of infection.
I just wanted to add to that with the pellets, we really get accurate blood level
Oh,
results,
yes.
which is really nice. So, unlike some of the other methods with the creams or the sublingual troches, the labs just can be variable just because of how they metabolize throughout the day. And so, this method we find is the best to really get you honed in where we want you and really know where you're at. And a lot of people feel really, really great on pellets and they're just coming in consistently and keeping it up and they do great.
Kind of gold standard for sure.
Yes. So we want to speak a little bit about risk. So when we evaluate you for hormones, we're making sure that we're looking at cardiovascular risk as well. Just because, we can sometimes, like if we give you estrogen, sometimes that's going to help increase the epithelial and endothelial lining of your your vessels. And so we just need to make sure that there's nothing underlining when we stimulate that estrogen again, if that makes sense. But really, we find that there's reduction in overall cardiovascular risk. There's been studies, that have gone through Cedars-Sinai showing this. And and as long as we're not using oral estrogens that bypass the liver, that we can actually improve cardiovascular health. But if we see that, we're seeing you every 3 months, and some of our patients don't have a primary care, so we don't do primary care here. We used to at Jerosa, when you saw us at Jerosa, but we want to make sure you also have a primary care and that you're keeping up with all your preventative. And that may be where I can't really speak to other hormone clinics, but with our background in primary care, we are looking at everything. Like, so we may do an EKG on you and here. We may do all this stuff that we can, like, pass you on to your other doctors, because we want to look at the whole picture. We want to make sure that you're not just coming in and doing pellets, and we get your blood pressure and it's high and we're like, like, we want to make sure, like, okay, like, that you're being treated. And so we do more, than just the hormones, because we don't want to miss anything else that's going on. And then this is a common question with what is the breast cancer risk of, and this is always on our radar too, to make sure you're up to date on your yearly mammogram. That's the gold standard to find any breast cancers. They have found, and there's many studies on this, that estrogen in itself, it can increase the density of a breast, making it harder to see a breast cancer. So a lot of the radiology centers now have gotten really good at, like, if they can't see as well, they want an ultrasound. So it's very specific with that. But really, estrogen, it can feed an existing breast cancer. So if you have breast cancer, there's estrogen and progesterone sensitive breast cancers that we would not use those medications to treat you. So we want to make sure that we're not feeding something that you have going on. And if we're not doing those yearly mammograms, then we don't know. And so that's kind of the risk there. And if you do have, like, an increased risk because of, like, family history, or you've had lumps that they're monitoring, then we're going to be extra aware that we may recommend, genetic testing. We may recommend extra testing, or if there may be times when we decide that, I don't want to give you estrogen because of your risk, or if you're not getting your mammogram, because even if you're aware of the risk, we may not be okay with
May not feel
increasing that.
safe, yes.
But overall, it's important that people know that it's testosterone actually is breast protective. We don't need to be scared of doing hormones because of breast cancer. As long as your practitioner is monitoring you and making sure you don't have any underlying.
Mhm. All right. So, one of the other things when we talk about estrogen therapy is, when we're giving you estrogen therapy and you have all your reproductive organs, estrogen can actually increase the thickening of your uterine lining. And if we left that uterine lining kind of thick and fluffy, is how I like to describe it, that can actually change the cells in there, which can lead to a risk for cancer. So it's really important that, if you're getting estrogen therapy and you've got a uterus, that we also counterbalance that with progesterone. That progesterone helps to keep that uterine lining nice and thin. So it really minimizes the risk for developing a uterine cancer related to unopposed estrogen therapy. So there are certainly ways that you can get your oral your progesterone, and it could be through an IUD, it could be through progesterone only pill. One of the benefits of progesterone is it is a natural sleep aid, so it actually can help improve sleep quality. So that's one of the benefits with it. And then certainly, to minimize or mitigate uterine risk, it's certainly important to stay in a good, healthy relationship with your GYN so that you can stay up to date on your pelvic and your PAPs. And then just a note, if you're starting estrogen therapy and you're taking progesterone, that bleeding can occur, bleeding and spotting can occur. Usually it happens typically in the first 4 to 6 weeks, and then it should go away. but we're not trying to cause full-blown periods again. So if that happens, then certainly is something that we need to have an open communication about because there's something there that we need to adjust. Either we need to increase a progesterone dose, we need to look further into holding estrogen, or maybe even getting an ultrasound to
Or biopsy.
and yep, and biopsy to investigate the cause because there should not be any bleeding whatsoever if you're taking your progesterone nightly. Anything to add on that?
Yeah, I think that shouldn't scare anyone away from
No.
it either. But it's just important to know that it's one of the things that we can very easily navigate and keep you safe. But yeah, we don't want you bleeding and we don't want you at risk for any thickening. So side effects. So the hormones can cause some side effects. And there's some ones that are more prominent and some that are less, but we can manage them. So hirsutism or increased hair, usually we're areas where we don't want it. Acne, there can be a little bit of weight gain. And this is usually when we do estrogen therapy, but some people have seen it with testosterone with like water retention and that sort of thing, swelling of the hands and feet, breast tenderness, excess libido, like, which I think some people might be okay with that, but some people that maybe don't have like any outlet for that, maybe they don't have a partner or then that can be a little bit much. Or sometimes like women come in and they're like, yeah, my husband was like running from me. I'm like, oh my gosh, like such third world problems. And then labial swelling or increase yeah, labia can happen with a increase or with a high testosterone. The spot bleeding and the bleeding and uterine cramping, like Christina mentioned. And then hair loss. So a portion of the testosterone does convert to DHT, and DHT is a form of testosterone that can actually clog the hair follicle. So, and not everyone is going to be prone to this. And it's interesting that there are like a urine and saliva tests that we can do to actually see like who is more prone to having those androgenic side effects than others. We don't always test for that because it's very expensive, but also it's like, well, we'll find out like once we do the hormones if that's you. But when we see that we can manage it and there's things that we can do. And so but then I've also had patients that have come in and that have had hair loss initially, and then we do hormones and it actually improves it. So everyone's different again. And then voice deepening, we don't see this very often, but with the testosterone. So again, these are just possible side effects, but we don't always see them.
And we have ways to support them.
Absolutely.
So, as far as the follow-up process goes, we've kind of mentioned it and alluded to it, but this is not a one size fits all. This is very customized and tailored, and it's a trial and error as well. So
Mm.
it's not, we take into consideration everything, but your doses may change and fluctuate, and it can be kind of frustrating until we find that sweet spot for you. So, follow-up process is, coming in to your regular appointments. The frequency typically is every 3 to 6 months where we do routine blood work to see where you're at. We certainly have a conversation to figure out where are you at, how are your symptoms, how are you doing? And then we're making sure on our end that we're monitoring, are you up to date on your mammogram, your pap, your bone density? And then certainly we always talk about, lifestyle, and all of it is in conjunction with a, healthy lifestyle. And then, we talk about a lot of questions I feel like people ask is like, well, when do I stop? How long do I have to do therapy for? And it really just depends on the person. So sometimes, there's some literature out there that says that the standard recommendation for the duration is not to go beyond the age of 60. Well, I know we have a lot of women that are beyond that
Mhm.
because they feel so much better with it. Their quality of life is improved. And, I feel like that's a little bit outdated because I feel like life expectancy has changed
Well,
too.
and it's just making sure that there's no risk,
Mhm.
and so that's guidelines, and we definitely don't ignore those guidelines. But yeah, like we have patients like in their 70s that still have horrible health issues. So, and we know that we're improving their bone health and so many other things. So those guidelines are there for, based on studies and everything, but we Yeah, everyone's a little bit different, and patients are constantly asking, like, how long do I need to do this? And so, honestly, they might have more symptoms in a certain time frame of their life, and so, sometimes we'll just say, like, if you'd like to just stop it for a little while, and you can see.
How you
And
do.
some do fine, but a lot of them come back, and their symptoms start to come back, and so we get back on it because they feel good. They're feeling good on them. So then they're like, well, how would I be off? And they don't know, and we don't know. So, if that
Makes sense for sure. And I actually had a lady that was trying to not do her pellets for a variety of reasons, but it was
mm,
actually her eye doctor that was like, no, you need estrogen therapy because it's actually helping
interesting.
with your eye health. Yeah.
Oh, I love it.
Yeah. All right. So that concludes the main yeah, that concludes the main part of the presentation.
Any questions? So, just if you guys don't have any questions, we kind of have some here. So, what happens if I don't like the side effects of the pellets? So, a lot of people might be afraid of that. It might be, our type A control freaks. That maybe are like, well, once you put the pellet in, what if I don't like it? What if I feel, well, we can manage anything. I've never had, where we can't manage it. And we would never like try to take out the pellet, like trying to like remove it, like that would be like surgical. Like it's like wouldn't be safe. But if there's side effects, there's medications we can give. There's things that we can do to mitigate that. But most of the time, your effects of the pellets are going to be gradual. And call us and we can kind of work you through it. But if for the people that really are afraid of the pellets, and we can always start with the other options
yeah, that's the
as
nice
well.
thing is you can start with one and transition at any time.
Yes. And Rebecca just mentioned, I can attest to how amazing the pellets are. Thanks, Rebecca. Yes, awesome. And then some of you may ask, isn't menopause natural? Why would I try to disrupt Mother Nature? And some doctors, some of my patients have said actually that their doctors are like, and usually they're probably males or women that through menopause will say like, no, that's natural. You don't need that. That's
They
unhealthy.
didn't do that 50 years
Right.
ago or
And
whatever.
just remember that, in the 90s, the Women's Health Initiative, with the big, announcement that went out like stop your estrogens, it's causing breast cancer and all this stuff. And that actually did more harm than good. Really, they were ripped all the people off their hormones and then they're institutionalizing women for going crazy. And really they found, they did studies years later, finding that they actually did more harm than good, and that actually that's when they found too that the breast cancer it wasn't related to the estrogens that they were getting at all, and they probably were better off just staying even on the oral estrogens at the time. But unfortunately, like once they kind of like debunked those myths, they never went back and did a big public service announcement. Like, oh, it's okay to do your hormones. And so some people are unfortunately still stuck in that mindset, and some doctors are stuck in that mindset. So then you may really trust your doctor and you ask them and they say no, don't do it, and so it makes it really hard and confusing. But the hormones have come a long way over the years, and even since I've been doing them we've seen a lot of strides, so it's very promising. So
Yeah, a lot of big changes.
and then thoughts on starting during perimenopause. Great question. So, especially if you are having some symptoms in perimenopause, it's a really good idea to start hormones. We have the decline in perimenopause of these hormones, and it might not always show up on your labs. Or with all the different symptoms. But sometimes we may start a perimenopausal woman just on testosterone because they're making their own estrogen. But sometimes we may find that even a little bit of estrogen support can help them as well. So we yeah, definitely, we have women doing pellets. I mean, I think, in their 30s. So it doesn't have to be necessarily that they're menopausal. But testosterone is a big one that we would start in perimenopause.
And a lot of therapeutic benefit with it too. Like testosterone really, I feel like doesn't get enough credit for all the good that it can
Hmm.
do and how much better people feel with it, improving their
Yeah.
energy, motivation. And I mean, there's so many good things to it. And then helping drive down and support our thyroid health and then helping with our cholesterol levels. So there's a lot of really good benefit with it as well. So that's a great question.
Right. And when you mentioned thyroid, so we definitely
Mhm.
do look at your thyroid and we look at it differently than, the
Mhm.
traditional endocrinology ways. And we were taught that, at our last practice as well.
Mhm.
But the sex hormones and the thyroid hormones are very, very closely related. So
Mhm.
sometimes if we see that you're even just borderline, we might just watch it. And once we get you on hormones, the thyroid improves. Or
Yes.
if it doesn't, then we may want to treat. And so we're always watching that and right along with it because they both, our thyroid's our engine and it's a hormone as well. So
Mhm.
that is a very big part of our practice also.
Yes. And, to the point of like reference ranges, not everybody fits into that normal reference
Right.
range. And we have very different levels that we are targeting that we know people feel best. So,
Right. And we'll look at, the different components of your thyroid and the T3 and that sort of thing too. But we also are very safe with our treatments and we are checking you very frequently. We're making sure we're not hyper,
not too frequently. Do you feel like people get annoyed with how frequent we do it?
maybe. But once they're stable, we
Yes.
kind of decrease that. But we also, we know that it is a very important thing to test as well. And if we're sitting here just treating their hormones and we're not checking their thyroid, then we can really be missing the mark. I mean, they
Absolutely.
can still be feeling like crap. And then
Mhm.
so it's just part of what we need to be
Full picture.
testing. Exactly.
All right.
If you guys have any further questions, feel free to reach out even outside of this chat.
Yeah.
All right. So, everyone, thank you so much for joining and carving out a little bit of time in your day. And we know you have a lot of choices of where you go for hormones. I know when we practiced back in the day, there weren't a lot of places, but a lot of places are doing hormones now. So, we know you have a lot of options. And if you don't go to us, we just ask that you make sure wherever you go is fully trained, is knows what they're talking about, and that's
Maybe.
looking at all those
Yeah.
safety and that's why we want to educate you as well because those things are things that you would watch for in how you're treated. So
Thank you, everyone.
all right, bye-bye.
Bye.